What's up, guys? Dr. Mo here with digitalnomadhealth.com. A question I get a lot is edema. So, edema is lower extremity swelling, and in some cases, it could be all over the body. You can get swelling, water retention in your arms, in your face, in your neck. And it's both uncomfortable, but it is also quite frustrating. A lot of questions like, why is it happening to me? What is it that I can do about it? And is there a way to treat it permanently? So for the most part, if you're a healthy individual, it is quite normal to retain some water, especially if you have something that is high carb or something with a lot of salt, especially if you drink a lot of water without a lot of minerals in it, so highly filtered water, it's easy to retain some water. And this water retention, which we call edema, can even make you feel a little bit heavy and sluggish. You can get some cramps because if you retain a lot of water, you're also going to have to pee that water out. And when you pee that water out, you're going to lose some minerals, magnesium, sodium, potassium, all the good stuff that you want to keep inside your body. A lot of us know that when we're traveling and we're on a plane or even sitting in a car for a very long time, we tend to retain water. Your legs get puffy, you take your shoes out, you take your feet out of your shoes, and all of a sudden you can't fit them back in. That's just because there's water retention. And it is mostly under the skin. It is not inside the entire structure of the leg, for example. Some ways that you can immediately get rid of that is just gently massaging. So if this is your foot, you gently start massaging this way from the end all the way up to your leg. And that can be quite helpful. Moving, just gently flexing and expanding. You don't need to do a lot. Extending your feet and toes and flexing your feet and toes can be a quite effective way to get rid of some of that swelling and edema. Other things that are quite effective are compression stockings. Some people wear compression socks, compression stockings, and those can be really effective, especially when you're traveling or sitting in a car for a long time. Sitting for a long time in general can cause it because you're compressing the veins and the lymphatic system under you. And so shifting your position can be quite effective. Getting up for a bit of a stretch and a walk can help decrease that water retention. A lot of my patients are also on quite a few hefty dosages of heart medications, and those they can make you retain a lot of water. Classically, I would say the beta blockers and the calcium channel blockers seem to be the most problematic. And when you retain that water, it's difficult to get rid of it. Exercise is a great way to get rid of that. And again, compression stockings. For some of my patients with heart failure, elevating the legs can be a great way to get rid of excess water retention. And of course, if you don't have heart failure and you don't have anything else wrong with you, and you suddenly are seeing swelling in your legs, it's a good idea to discuss it with your doctor. Figure out, why am I suddenly getting leg swelling and edema when I didn't have it before? It could be something as simple as your diet. It could be something about how much water you're drinking. And then come up with a good routine as far as how to get rid of it. Of course, you can take natural stuff. There are natural diuretics that make you pee a little bit more than usual, but there are also prescription medications. I try to not prescribe a lot of prescription medications for edema because it does create other problems. You lose your potassium, you lose your sodium, and suddenly you start getting cramping and other things. So always start with the most conservative methods and go from there. So if you have any problems with edema, if you're struggling with any kind of water retention, head over to digitalnomadhealth.com, book a session with me. I'd love to help you with it. I'm currently licensed in California and Alaska. So if you're in any of those states, you can connect with me directly and we can have a telehealth visit, virtual visit. But if you're outside of those states or outside of the country, I can do a session with you, and it would be mostly an informative session. I cannot be your doctor. We cannot engage in a patient-doctor relationship, but I'm happy to answer any general medical questions that you have and at least point you in the right direction. So, digitalnomadhealth.com. This is Dr. Mo. Take care.